Good day. My name is Shannon Sullivan. I'm one of the adult clinical dietitians at the Medical University of South Carolina. Today I'd like to talk to you about preventing tube feed clogs. Clogged feeding tubes present a myriad of problems for both patients and clinical staff, including causing the delay in delivery of nutrition support, resulting in lost calorie and protein intake, increased risk for the patient due to the additional patient procedure required for tube replacement, and lost staff time spent declogging or replacing tubes. If you think a patient's enteral tube may be clogged, check for these signs: difficulty flushing the tube with a water-filled syringe, inability to aspirate from the tube, continual sounding of the occluded alarm on the enteral feeding pump, or leakage of formula from the insertion site with pegs, pedges, G-tubes, or J-tubes. One of the easiest ways to prevent clogged feeding tubes is to ensure adequate water flushes. Always use a 30 cc or larger syringe with 20 to 30 cc's of water. A smaller syringe can add excessive pressure on the tube, causing it to rupture. Make sure to flush a tube at least every 4 to 6 hours with continuous feeds. For bolus feeds, flush the tube before and after each bolus. Flush with 5 cc's between each medication. Flush after checking residuals, and flush after feeds are held. Remember to record all flushes in the patient's daily record. Proper medication administration is another way to reduce the chances of clogging enteral feeding tubes. Administer liquid medications when able. Never mix meds into the tube feed formula. Do not administer sublingual or buccal meds into the feeding tube. Always crush tablets into fine powder and empty capsules into warm water before flushing. Administer medications separately. Never crush or administer enteric-coated, extended-release, or effervescent tablets. Avoid granular medications. Dilute and flush if it is necessary. Another area of prevention is proper tube size. It is best to use an 8 to 10 French tube because smaller diameter tubes may clog more easily. Choose a larger tube if a thicker formula will be administered, either fiber-containing formulas or high-calorie formulas such as Traumacal, Nepro, or Gevity with fiber. Always use proper flushing techniques. Using a continuous feeding pump with thick formulas can prevent clogs. Using automatic flushes with pumps further reduces risk of clogging. Feeding tubes naturally degrade because of the action of stomach enzymes. To reduce the rate of tube degradation, always wash hands with soap and water and use gloves when touching the tubing in order to reduce the transfer of yeast to the tubing. Yeast can cause the tube to narrow or become deformed, which can result in clogging, restricted product flow, or a collapsed balloon inflation channel. For further information on tube feeding issues, contact your dietitian. Thank you.